Our next speaker is Ms. Renee St. Louis. She is a research area specialist in the behavioral sciences group of UMTRI, and her talk today is called Review of Prescriptions and Other Medications and Supplements.
Okay, good afternoon. So today I am going to be talking about another piece of our data collection activities, and we'll be focused on the medication use of our participants. So first, I just wanted to acknowledge Dr. Emmy Betts from the University of Colorado. So she actually sort of spearheaded this piece of our data collection activities, but also to recognize all of our other Long Road collaborators that really took a lot of time in developing this data collection instrument and getting it to where we have it today. So just a bit about aging and driving, things that we've already heard about today. So when we're talking about these driving issues that we're seeing in the older adult population, these driving issues aren't due to age per se. So we've heard a lot today about the diversity of the older driver population, the differences in sort of how people go about that aging process. So when we're talking about this older population, though, the thing that we are sort of focused on the most are these medical conditions that are just more common in the older population. So these conditions then can lead to declines in abilities that affect driving. And this is just an example of a lot of different medical conditions that are more often seen in that older driver population. So a lot of these are, or probably all of these we're capturing within our data collection activity. I think Dr. Hill might talk a little bit more about some of these medical conditions. But when we're thinking about those medical conditions, then we have to think about the medications then used to treat those medical conditions. So a study by the Urban Institute, another one of our Long Road collaborators, they released a report in 2014, so pretty recently. They were using NHETS data and National Household Travel Survey data, and among other things, they were looking at medication use among people 65 and older. So what they found was that over 90% of older drivers are taking at least one prescription medication. And then those that are taking at least one, over 2/3 are taking more than one. So this issue of medication use and polypharmacy it has a lot of impacts on driving safety, but it's such a complex issue that sometimes we're not exactly sure if it's maybe the medical condition that's having those direct impacts on driving safety, or is it the medications that are having that impact. So it is very complex, and to tease out the actual impacts is something I think that once we have all this data gathered through Long Road, it'll help us kind of understand the medication use aspect. So again, individual differences in how medical conditions and medications affect driving skills, it adds to that complexity. And then also there's individual differences in how medications or multiple medications may affect one person, or what time of day they take their medication, have they eaten. There are just a lot of reasons why having that sort of direct correlation between medication use and sort of driving skill is more complex. So for the Long Road study, what we're doing is something called the brown bag medication review. So a lot of our participants take this quite literally and say, Renee, I searched all over for a brown bag and I couldn't find one to bring my medications in, so I had to bring it in this clear bag. I say, that's fine. It's just this generic term for bringing all your medications with you. So at baseline visits and then every other year, we're asking our participants to bring all of their medications and supplements with them. And what we do during that baseline visit is sit down with the research assistant and go through every piece of medication that they bring in and get all the information we need from them. So really our goal is to determine not only what they're taking, but how they're taking them. Because there can be some discrepancies between how the medication was prescribed and how they then decide to take it. So really, it's a more thorough and accurate way of assessing medication use for our participants than just relying on information in their medical record. So again, a lot of participants will say, Renee, you have access to my medical record and all that information is there. Can't you just look at that? But our reason for that is the strength of the brown bag medication review is to really get at how they're taking their medications and not just what is in their medical record or what was prescribed by the doctor. So we have them bring in all of their prescription medications, over-the-counters, vitamins, supplements, herbal medications, any creams, liquids, injectables, inhalants. We have a refrigerator on site in case any of their medications need to be kept cool. And then we start going through each prescription at a time, or each medication or supplement. So there's a whole host of information that we're gathering regarding how and what they're taking. So for each thing that they bring in, we have the generic name, the brand name, we get the dose and the units. So just a few examples. We have milligrams, micrograms, tablets, drops, units, you name it. If there are supplements or medications that have two drugs in it, we can differentiate between the doses of the drugs. How often they're taking it, is this as needed, what is the route of ingestion, is this actually prescribed by a physician or other clinical practitioner, or did they sort of learn about it on their own and brought it into their own daily habits? Are they currently taking it? So sometimes they do bring in medications that they're not currently taking, but they might take them in the future, or they stopped taking it a few weeks ago. And so we document all of that as well. Are they taking it as directed or as suggested? So yes is they are taking it the correct dose and at the correct times. No is neither of those. And then partial is maybe they take it the correct dose, but they only do it when they feel like it. So side effects, if they are experiencing any side effects, we like to know some details about that. So common side effects we hear: drowsiness, sort of fogginess, haziness, increased urination. We also record the method in which the review is conducted. So having them bring all of their medications is sort of like our gold standard. That's what we would prefer. That way we have sort of access to everything we need right there. But oftentimes they do bring a list from their pharmacy or from their provider, and we can work from that list. Sometimes they have their own list, and rarely they can do it from memory, but that's only when they're taking a couple. Sometimes they have all the information in their head about it, but we'd definitely prefer for them to bring it all in. And then really, like, the strength is having that conversation with them about how it's prescribed, how they're taking it. And then we have a notes section to document any additional details. So if there are inconsistencies or discrepancies between how the doctor prescribed it and how they're taking it, or just any additional details that might be helpful. So this is just an example of some of the different types of information we're looking at to gather sort of what we need. So our research assistants have become very adept at figuring out exactly what they need from a bunch of different sorts of labels, and they've become very good at doing some simple math on the fly. So for instance, you could have an inhaler that says there's 90 micrograms per actuation, but they take 3 puffs at a time. So just quick, simple math. And then figuring out where everything is on the labels to fill in all of the information we need. And then in the list too, they can figure out exactly what we need. So what we've been seeing, at least at the Michigan site, here are some common medications we've seen. So definitely like the low dose aspirin is huge. Vitamin D, I'm not sure, maybe the other northern states have also experienced almost all their participants having vitamin D. Not sure about our colleagues in San Diego, sunny San Diego. Even the participants make sure I'm taking my vitamin D as well. Lots of multivitamins, fish oil, nasal sprays, omeprazole, various antacid, acid reflux, medications, different sorts of over-the-counter pain relievers. In talking with our research assistants that run all the participants, we haven't seen too many sort of like higher strength pain relievers, so which is interesting. So lisinopril, atenolol, blood pressure lowering drugs, statins, so simvastatin, atorvastatin, things like that for lowering cholesterol. And also talking with our research assistants, we were trying to figure out what's the highest number of medications people have brought in, and we figured out it's 34, so that took some time to get through. So it's pretty uncommon that somebody comes in with taking 0 medications, but it's pretty uncommon to have 34 as well. They at least have a handful. We've seen some interesting ones too, broccoli extract root, bitter gourd juice, not even sure what that is, but interesting things people are taking. So in looking at some of these possible questions to consider when using this data, I was talking to some colleagues and we sort of came up with just some questions about what we could think about writing papers in the future, about the association between self-regulation of driving and medication use. Are there different classes of medications that are associated with crashes and violations, which Jennifer will talk about later? Do supplements and over-the-counter medications relate to health functioning in some way? What are psychosocial correlates associated with the use of medication? So we're really just trying to build this large database in order for us to learn more about how medication use can maybe more directly impact driving safety in older adults. That's it. Thank you.